Today is May 25, 2025. In this special report, we will journey through the most pressing viral developments affecting global health. Together, we will uncover the context, underlying causes, past precedents, societal impacts, and expert interpretations surrounding these emerging issues, offering you a comprehensive, steady guide through a complex landscape. Across Southeast Asia, a concerning resurgence of COVID-19 has been unfolding over recent weeks. This resurgence is driven predominantly by new subvariants of Omicron, particularly the JN.1 lineage, which has shown an increased capacity for immune evasion. Countries like Singapore, Hong Kong, China, and Thailand are experiencing marked spikes in infection rates. In India, recent surveillance data recorded over 160 new cases in less than 2 weeks, most of which have been mild and managed without hospital intervention. While the direct health threat appears manageable at present, public health authorities stress that the situation serves as a stark reminder. Despite widespread global fatigue around the pandemic, the virus remains dynamic, evolving, and capable of slipping past our defenses if vigilance lapses. Vaccination campaigns are being reinvigorated, targeting booster shots for vulnerable populations, but experts caution that the real challenge lies in sustaining public trust and compliance after years of crisis management. Meanwhile, a quiet but worrying signal has emerged from the United Kingdom. For the first time, the West Nile virus has been detected in native mosquito populations, particularly in Nottinghamshire. This mosquito-borne virus, historically confined to parts of Africa, the Middle East, and North America, has now crept into new territories, largely due to the shifting climate that has expanded the habitable range of disease-carrying insects. Though no human cases have been reported so far, the presence of the virus itself is a flashing yellow light. Experts are now calling for strengthened mosquito surveillance programs, environmental management efforts, and public awareness initiatives, drawing comparisons to similar unexpected outbreaks, such as the arrival of Zika virus in southern Europe several years ago. This development once again places climate change at the center of public health discussions, highlighting how planetary shifts ripple through ecosystems and, eventually, human health. Turning to South America, Brazil has reported its first-ever outbreak of highly pathogenic avian influenza, H5N1, in a commercial poultry farm located in Rio Grande do Sul. While avian influenza is well known among veterinarians and agricultural officials, this event marks a significant escalation for Brazil's poultry industry, one of the largest in the world. International markets responded swiftly, with several countries imposing trade restrictions on Brazilian poultry exports. Though the direct risk to humans from this outbreak remains low, H5N1 rarely jumps to humans without close contact. The economic and logistical impact is substantial. This situation echoes past avian influenza outbreaks in Southeast Asia and Europe, where animal health events triggered cascading effects on food security, trade dynamics, and public anxiety. Brazilian authorities are ramping up biosecurity measures, culling affected flocks, and enhancing surveillance, but questions remain over the long-term resilience of global poultry supply chains in the face of these recurring viral threats. From the realm of medical research, a significant discovery has emerged linking herpes simplex virus type 1, known commonly for causing cold sores, to an increased risk of developing Alzheimer's disease. A long-term analysis, spanning 15 years of health records, has found that individuals infected with HSV1 are approximately 80% more likely to develop Alzheimer's compared to those without the infection. Fascinatingly, the same study reveals that antiviral treatments used to manage herpes infections can reduce this heightened risk by about 17%, opening the door to potential preventive strategies against neurodegenerative diseases. This finding draws fresh attention to the long-standing but underexplored theory that chronic viral infections may play a pivotal role in shaping the risk of dementia, a condition traditionally framed as purely genetic or age-related. Experts emphasize that while causation has not yet been definitively established, this evidence pushes the scientific community toward investigating how managing latent viral infections might transform the landscape of brain health in aging populations. In Australia, Health authorities are bracing for what some are calling the triple virus threat this winter season, as influenza, COVID-19, and respiratory syncytial virus, or RSV, circulate simultaneously. Laboratory data indicates a sharp rise in flu cases, especially among children and elderly individuals, with vaccine uptake still lagging behind public health targets. Authorities are issuing strong appeals for people to receive updated flu vaccines and COVID boosters, while also encouraging basic preventive behaviors like mask wearing in crowded indoor spaces. Drawing from lessons learned during the pandemic, Australian experts highlight that community-level protection hinges not just on vaccination, but on layered strategies that combine pharmaceutical and non-pharmaceutical interventions. These seasonal waves reflect the cyclical nature of respiratory viruses, but they also underline the importance of maintaining public health readiness, even in the absence of formal emergencies. Looking to Africa, the Democratic Republic of the Congo continues to battle an epidemic of Mpox, caused by a new variant of the monkeypox virus. Since January 2024, the country has reported over 29,000 cases and more than 800 deaths, placing immense strain on an already fragile health system. The World Health Organization has escalated its classification of the outbreak, declaring it a public health emergency of international concern. This designation is not made lightly. It reflects a combination of rising caseloads, regional spread, and the risk of cross-border transmission. Experts warn that, without robust international support, the outbreak could spiral further, drawing parallels to the 2014 Ebola epidemic in West Africa, where delayed global response amplified human suffering. Efforts are now focused on expanding access to vaccines, improving case detection, and bolstering community engagement to break chains of transmission. Meanwhile, a surprising new angle in the field of preventive health has emerged, spotlighting the shingles vaccine. Recent analyses suggest that, beyond protecting against herpes zoster infection, the shingles vaccine may offer broader health benefits, including a reduced risk of dementia and major cardiovascular events. Researchers speculate that the vaccine's immune-boosting effects may extend beyond its original target, offering cross-protection against systemic inflammation and other underlying disease pathways. These findings are reshaping discussions about vaccine value, encouraging healthcare systems to consider not only the immediate, disease-specific impacts of vaccination, but also its potential ripple effects across long-term health outcomes. As we stand back and reflect, it becomes clear that the global infectious disease landscape is shaped not by isolated events, but by interconnected forces. Viral mutations, climate pressures, changing human behaviors, and the ongoing march of scientific discovery all converge to produce a dynamic and often unpredictable reality. To navigate this landscape, public health systems must remain adaptable, informed, and vigilant. The lessons of past outbreaks, from SARS and Ebola to COVID-19, remind us that early detection, transparent communication, and coordinated action are the bedrock of effective response. But these lessons also emphasize that the work does not end with crisis containment. Long-term investments in surveillance, research, healthcare infrastructure, and public trust are essential to building resilience against the infectious disease challenges of tomorrow. Thank you for joining us on Infection Navigator. Stay informed, stay thoughtful, and take care.